Well, thank you everybody for joining us today on a Wednesday evening. My name is Brianna Obst, and I am the Associate Director of Theatre, Education, and Arts at Miami Children's Museum. My pronouns are she, her. For my visual description, I am female presenting, white person with some freckles, a lot of them. I have dark curly hair, and today I'm wearing a dark museum t-shirt. It has a small logo, and behind me is superimposed is a sunny Miami day with the Miami Children's Museum behind me. I do want to welcome everybody to our quarterly conversations, today titled Coping with Uncertain Times, Helping Children Navigate Mental Health. Before we begin, we here at Miami Children's Museum are on the homeland of the Tequesta peoples, Calusa peoples, United Confederation of Taino people, Seminole Tribe of Florida, and the Miccosukee Tribe of Indians of Florida. We thank these past, present, and future caretakers of the land and water, because we're surrounded by it, for their stewardship. I did want to open by welcoming everybody and just to acknowledge that our topic is a big one. And that we are focusing on, when we talk about children, the demographic that we serve here at the museum, which is generally 0 to 8, and we can push 0 to 10 years old. So we are focusing on our tiniest of humans today. And we hope that today you can walk away with some tangible resources, tips, and methods to assist you, your children, your institution in combating the mental health crisis that we are in. We hope that this panel is an interactive one. So please ask questions. You can raise your virtual hand, your hand, pop it in the chat. And we do like to say that this is a safe space. You know, we're all here for different reasons, whether we want to learn, whether we are an expert. So we ask that everybody be respectful of people's opinions, questions, comments, and concerns. So quarterly conversations started officially at Miami Children's Museum in December. And it is something that we have found that to be in par and in line with our mission here at the museum, and trying to reach out to the people and who are youth workers, parents, educators who may be needing some help on some big topics. And so here we are to our second quarterly conversation called, as I said before, Coping with Uncertain Times, Helping Children Navigate Mental Health. Now, in December, during 2001, during a very, very, very rare public advisory, the US Surgeon General confirmed that the youth of America is facing a mental crisis and declared it a national emergency. And to quote the US Surgeon General, he said, mental health challenges in children, adolescents, and young adults are real and widespread. Even before the pandemic, an alarming number of young people struggled with feelings of helplessness, depression, and thoughts of suicide, and rates have increased over the past decade. The COVID-19 pandemic further altered their experiences at home, school, and in the community, and the effect on their mental health has been devastating. The future of our country depends on how we support and invest in the next generation. Now, if you are interested in that particular advisory, I'm going to post a link in the chat so that you have that there as a reference if you would like to look at that later on. To everyone. There it is right there. Now, to help us unpack this advisory, to help us unpack where we are with children today and to answer your questions, we've put together a pretty incredible panel for you that I'm excited about, and I hope that you are too. So let me introduce you to all these women. I guess we're also on theme with Women's History Month right now. So let me introduce you to everybody. Firstly, I will start with, just because my Zoom squares look this way, so no particular order. with Dr. Cat. Now, Dr. Cat, or Dr. Katie Hart, is an associate professor of psychology and licensed psychologist at Florida International University and the Center for Children and Families. She is the director of Reading Explorers program, as well as the Children's Trust Parent Club in partnership with FIU. She's also the proud co-director of the Summer Treatment Program for pre-kindergartners. So welcome, Dr. Cat, and thank you so much for being here on a lovely Wednesday evening.
Happy to be here with all of you.
Excellent. All right, my next Zoom square rectangle panelist is Dr. Marina. Welcome to Dr. Marina G. Villani Capo is employed by Nicklaus or Nicklaus, children's pediatric specialist. She is the lead physician-led multi-specialty group practice of Nicklaus Children's Hospital Health System. She is a child and adolescent psychologist within the Department of Psychology, and she is here with us today. So thank you, Dr. Marina.
Hey, everybody, welcome.
Welcome. All right, my next Zoom square is Dr. Marva. Welcome, Dr. Marva. Dr. Marva Lewis' research focuses on the development of culturally valid research methods, child abuse and neglect, and racism-based stress. So thank you so much, Dr. Marva, for joining us tonight. And last but definitely not least, we have, there we go, Dr. Julia. And Dr. Julia Harper, PhD, MSOTR/L, is a wife, mother, occupational therapist, business owner, psychologist, life coach, and mentor, speaker, and writer. All of those things. Thank you, Dr. Julia, for joining us tonight.
Thank you so much for this invitation. Very happy to be here with everyone.
Yeah, excellent. Don't forget, people, please, be active in the chat. We'd love to hear from you, where you are, who you are, and of course, if you have any questions. My first question to open up this panel discussion is, yes, the US Surgeon General said we're in a crisis, and we can easily name so many things on every finger and toe and nose that we have that could let us know why we are here in this situation. But my question is, how did we know it's a crisis? What are we seeing in our children today that is different, that is magnified because of the pandemic and what we've been through? What is different, and why is it called a crisis? Why are we in a state of national emergency? So big question, panelists, if you like to raise your hand or go for it, I am happy for you to take the lead. Don't be shy, ladies.
Okay, so I'll jump in.
Thank you.
I will begin by saying, as an occupational therapist, a psychologist, I work in a center that attracts clients from not just the Miami area, but throughout the world. And we work on brains and on minds. And just in terms of what I'm seeing anecdotally, and of course it's played out as well in the research, we're seeing a huge increase, not just in the numbers, but in the types, the level of severity and the amount of comorbidity that we're seeing in our children. I treat children and their families and specialize in neuroplasticity, working with kids with learning disabilities, behavioral issues, challenges with regulation. And we're seeing much, much more emphasis on attentional problems and emotional regulation problems. There's a lot of comorbidity, anxiety, just the number of prescriptions being written for anxiety medications. And, sometimes just to put a little bit of lightness in it, I'm from the Caribbean, so humor is something that we use a lot. To add a little lightness to it, I say, what are the kids all anxious about? They didn't have money to pay their mortgage? Really, why are we seeing so many children with anxiety? What exactly are they anxious about? And, the answer to that for for me, when we look at anxiety, we see generally, I say anxiety comes when you are trying to control that which you cannot. You're trying to deal with the uncontrollable, the uncertain. And to the topic of tonight's panel, there's so much more uncertainty. Life is always uncertain. The only constant in life is change. And I think that there is a certain degree of uncertainty that has raised the bar, and there's a certain amount of intensity to it. Things are compiling. We're not just dealing with one uncertain thing at a time. We're dealing with COVID and war and I think all of those crises come together has created such a crisis of anxiety and emotional dysregulation that it doesn't surprise me that we're in this position.
Yeah, makes sense. Dr. Marina.
Yes, answering your question about why crisis, I think at this point in time, people are more well-versed in what mental health really is and the importance of actually addressing it. I think, us panelists, I'm assuming, right, we've always known there's a mental health crisis throughout multiple generations. I'm from Puerto Rico, so I know, my specialty was in sexual abuse and trauma, and just being in a hospital setting nowadays, in a pediatric health hospital, our problem has always been, since I've been there, our wait lists and not enough resources to address and increase access to these services. So the meaning of crisis for me is when we have a big problem that now we're addressing finally. We're putting a big magnifying glass, that being thank you for social media or access to more information from our kiddos. But now we're understanding the need, the lack of access, the health disparities, and how that needs to change because our kids are our future, right? Everybody likes to say kids are our future. So we need to invest in our kiddos. So answering that question, I think that's why finally we're using the word crisis, but I think all of us here present have known it has existed from multiple generations, unfortunately.
One of the questions somebody had pre-registered just on what you were saying, Dr. Marina, is like, where do you seek professional mental health for children and adolescents? And basically said every local place has 6 to 9 month wait list. Is it affordable? And that was something, when I was reading about the US Surgeon General's announcement, was like putting it as a national emergency was one of the like practical things was to try and implement better access, more of it and affordable. But where does a parent start?
Well, I think my professional opinion is when we start seeing significant changes, I feel like caregivers in general, because sometimes not only mom and dad, it's grandma, aunt, the village. When the village knows that something is not right with the child, and you are the expert in your child, when you know there's changes in sleep, there's changes in mood, meaning they're extra irritable, they are isolating socially, their eating patterns have changed. All those little changes we need to be very observant of. And that takes time, right? Because we're all moving in a very fast pace. We all here working women. So it's really hard, but if we take the time and we see those little changes in our children, don't be afraid to ask if something is going on and have those open conversations with open-ended questions, meaning, how are you feeling today? So when to seek out help when you feel like something is wrong or something has changed and you feel like you don't have the tools to address it yourself because you yourself are going through a lot, then it's always good to ask for help.
Yeah, Dr. Kat.
I think that I love Marina's suggestion that it starts at home, and during these unprecedented times, parents and their children spent a lot of time together when we were on lockdown, maybe more so than we ever had before. And we're part of our children's lives in ways that we were really tested. I have 2 young kids at home. I study early childhood education and very much appreciate the early childhood workforce that we have. But being a teacher, and I'm a professor, so I teach all the time, being a teacher for my own kids and, cultivating that learning at home in addition to working, was really challenging. And I don't think I'm alone in that. I think we were all, as parents, the stress was real. And we saw our kids in new ways, and their behavior, their learning, all of those things in new ways. And I think where the question is, where do you go for help? Oftentimes for parents, that starts with your pediatrician, and that, it could be your pediatrician or your child's teacher, those other caregivers that can give you some perspective of, is this typical of a child that is, my child's age, given the same situations and same context. And then, here locally in Miami, at least, we also have many resources. There's the Warm Line, which is a line that parents can call to find out information. They do a brief developmental screener to see where kids are, and that's specific to young children. But similarly, I think encouraging parents to talk with their pediatricians, talk with their school personnel, our schools. And, that's, I think, what's also exacerbated these problems when then we were removed from the school community and everything was via technology. It made it really hard to make those connections. And so I know this year, as people are reconnecting, they're starting to realize, like, wow, this is a lot more than we had all anticipated.
I'll just add to the really good suggestions of resources that the other panelists have brought up, is let's not forget the resource of other parents. The work that I do has to do with building community among parents. And as you noted, Marina, the crisis for some communities, especially targeted communities, has been going on for generations in terms of trauma, historical trauma, violence, and no resources, not low resources, but no resources. So I've done work with parent groups in homeless shelters. And so they're, of course, in crisis with no housing and many other challenges that they're facing. But when they can work with each other, when they can realize that they can develop a relationship with each other and receive support. Now, as we know, it could be a ticking time bomb too, in terms of interpersonal relationships, etc., and hierarchies according to different statuses. But my message to parents in terms of helping children cope with the current crisis that's in the news, crisis that's in the media, what you can control, how much media your child's exposed to, how often you do things, and this is what I'm prepared to talk about tonight too, simple routines that you can involve your child with. You may not be able to get to your pediatrician, or you may not have a pediatrician. You may go to the clinic, the community health clinic, and have to wait in line there. But my message would be building community support among each other. The professionals in your life, you can ask, are there other parents who are dealing with the same issue around my child's anxiety? You can ask other parents. But I really stress the resource that we have within our communities among ourselves as parents is invaluable.
Absolutely.
Yes, Dr. Julia.
Yes, and I just wanted to add one other thing, and that is using yourself as a resource. I certainly do appreciate that, in the context of what we've gone through in the pandemic, being the parent who had to be and do everything for your child and how much pressure that is. And so this isn't about giving you more homework. This is just actually a call into yourself. Our children learn what they live. So, and you are their greatest resource.
Yes.
Our children are going to learn how to model anxiety and how to model, how to handle anxiety and uncertainty from you. And so one of the questions I ask parents that I work with all the time is, what's your story? How do you show up in these uncertain times? How do you show up when anxiety is present? What are you demonstrating? And I'm not saying at all, mamas too, that this is about creating a perfect picture and smiling and never being anxious, but it really is about knowing that the most primary resource your child has is yourself. And that takes me to, and if you are not making yourself a resource for yourself, if you're not connected to yourself, if you're not connected to what's going on inside of you, then your model isn't necessarily one that your child can follow, and then it trickles down. And so, yes, there's an importance around finding support, community, and outsourcing, because we all need it, right? We're better together. And then I remind us of insourcing.
For sure. That, yeah, excellent point. Everybody, actually.
Yes.
I'm wondering, just a really practical, I know, Dr. Katie, you mentioned the warm line. Are there any other free access or affordable access mental health phone lines, clinics that, whether it's focused here in South Florida or nationally? You know, because that was a very common question, you know, whether it's healthcare, poor healthcare coverage or no healthcare coverage, that mental health and helping your child through this, you know, with professionals is expensive. It can be. So, Dr. Marva, your hand went up.
There's the National Organization of 0 to 3. They have a plethora of resources available to parents via the web. They have local groups within states, and you all can probably, I'm sure, speak to state resources related to infant mental health. But if they put 0 to 3, spell out the words, or maybe I'll put it in the chat box, 0 to 3, that national organization has a plethora of mental health resources. The American Psychiatric Association has any number of resources. Some of the professional organizations, literally you can go online and type in the professional organization, Association of Nurses, Association of Black Psychologists, the Association of Black Social Workers, Association of Latina psychologists. There are any number of professional mental health organizations that, in response specifically to this crisis right now that we are currently in, these professional organizations are offering free or no cost or sliding fee scale resources for parents virtually.
Which is great. And just to note, I'll go Dr. Marina and then Dr. Katie, that any of these resources that are mentioned in the panel, we will be collating them and be emailing out to everybody present tonight. So in case you missed something. So Dr. Marina, to add to that?
Yes, so when I get questions about, you know, pragmatic resources and things like that, I always send parents to 2 websites that I trust, because they also have information in English and in Spanish, which is very important to have multiple language and access to different, you know, language like Creole, Spanish, English, the Child Mind Institute, and kidshealth.org. You can actually, they have like a little magnifying glass, and if you have a specific question about how to talk to my child about grief, or the pet passed away, how do we, things that could be very mundane to things that can be very large, like war, and they will have bullet points in Spanish, English, and different languages. I think that was my first point. And my second point was always tune into the social media of your local community health center or your community children's hospital, because on our end, I know for a fact that the way we have tried to tap into increasing access, and I know FIU as well, we've created a network with FIU, we've partnered up with community resources, is we're in TikTok, we're in Facebook, we're in YouTube. And those are organizations like hospitals and community health-based programs and social media handles that can provide you with quick information about things that are happening in real time. For example, I saw in the chat something about Parkland Shooting. You can go into Facebook and there's different hospitals around the country that, you know, provided information in both English and Spanish and different languages about how to talk to your child. And they're really short. 10 minutes, 15 minutes, bullet points, very pragmatic at what to do. So I also wanted to highlight what your local institutions are doing to increase access.
And Dr. Kat?
Yes, I'd like to plug locally the Children's Trust, because I think we have a very, very unique community. I saw some folks were from North Carolina, and maybe you were in South Florida originally, maybe you already know of this resource, but you know, our county voted to have a proportion of our taxpayer dollars dedicated to this Children's Trust, and it extends, versions of it extend into Broward and Palm Beach and other counties here in Florida. But this is money that's dedicated and allocated to children and their families. And our local Children's Trust has really invested so much in mental health and in supporting youth in after school, in summer programs, in clinic-based, in parenting programs. You mentioned in my introduction the Parent Club, which is a free resource that parents can come and then get connected with other parents to learn and get information to how to support your parenting journey from 0 to 18. And I would say it extends on, as Julia knows, and her older children. And I think what has been amazing about that is that for the majority of the services funded by the Children's Trust are free for families. There still are wait lists, but they are not as long as 6 to 9 months typically. And there is also what I think is amazing, especially given you know, I think a lot of trauma that has happened through all of this is also trauma-informed approaches to mental health care, which is so important for families in this community. And I really appreciate the chat too around our local school district has also really invested dollars in mental health services. You do have to talk to your child's school to access those services, but they can send referral forms to entities like ours. I know our center at FIU is one of those contractors for then services, and we're doing all of that via telehealth and in person at the parents' you know, at the parents' preference and in multiple languages. So I think there's a lot out there, and you know, it even was part of the State of the Union address. I think there's more dollars coming, hopefully, to families and children and to adults. I know, you know, Julie also was talking about insourcing, and it is so important that parents take care of themselves and also reach out for help when they need it.
Mm-hmm.
Great, and there's Dr. Marva and Dr. Julia are throwing some things in the chat as well, resources. Okay, so moving on from resources, Dr. Marina, you in your introduction, or one of the first things you were saying, were listing behaviors that become out of the norm, sleep patterns, eating habits,
social functioning.
Yeah. So we can see these behaviors in our children, in our students. One of the questions we have is, how do we start to understand or figure out the reasons for these behaviors?
I think it depends on who is observing these behaviors, right? Because if you're a teacher, it's very different if you're the parent or if you're someone that's just grocery shopping and sees a child having a tantrum. So the explanations can be multiple, but for example, if you are the parent and you are the one that is observing these things, it's like, I think Dr. Kat was saying, talk to your teachers. You have to build your community. And I know that's not easy nowadays with everybody being inside their homes, and it's more easily said than done. But I always encourage my families and my patients to not be afraid to advocate for their children and to ask the teachers, even if nothing is going on, or maybe there's no news is good news, like they say. I always encourage parents to just at least once, just a simple email. How do you see, I don't know, Tim being at school? Is he socializing? Is he, when he goes to the cafeteria, is he sitting with people? Because as we know, bullying back in the day is not the same as bullying nowadays, where it's like by multiple angles, not only in school, but when they go home. So I always encourage parents to, not because you're not seeing these things, obviously, or you think they're just going through a moment or a phase, don't be afraid to ask teachers or the people that are most with your children. even other parents that might take care of your child because you're working. Again, it takes a village, and we need to sometimes humble ourselves and understand that maybe we don't see it, but be open to it. Someone else see it, be open also to that observation. Because I know sometimes we can get defensive, right? Like, what do you mean my child is, being the bully or bullying other kids or is sitting alone in the cafeteria? So I think being open to understanding and listening and actively listening to other people's observations is key as well.
Dr. Marva.
So I'd like to add on to Dr. Marina's really thoughtful points in terms of, being open, being humble. If parents, if we can think about, it's that quality of the relationship you have with your child. The work that I do has to do with attachment relationships, formation of attachment, what impacts attachment, parent-child bonding. If you use that same mindset to think about forming relationships with the people who are in your child's life, so that when there is a crisis, you already have open lines of communication. You already have, who it is you need to talk to. And we, in the work with parents, we understand in terms of if you're coming from a powerless, disempowered, invisibilized group, you may have difficulty talking to a teacher and with the perception that they're more powerful. But again, back to groups. So I would suggest to my parents, you go with 2 or 3 other people to talk with the teacher. But I'm suggesting that even before there's a crisis, you begin that relationship formation, you volunteer at the school. And now I know we are all too strained to even think about volunteering extra time. But when we put our child's well-being first, and we think, what can I do in my child's space to communicate a message to my child that I care about where you're at, where you're going to school, where you're going to the playground you're at, your friends, the friend's house, our neighbors, our relatives. You're communicating to your child in multiple ways, and then you can communicate with those helpers when it counts most, but in an everyday kind of way.
Dr. Julia? Thank you, Dr.
Yes, thank you, Dr. Marva. Of course, definitely takes a village, right? I wanted to add to the communication around why we might be seeing this is the relationship between brain and behavior. And, from a psychological point of view, we can certainly become very concerned when we see certain behavior present and we may think it's coming from the mind, what's going on in my child's world and what's affecting their state of mind, their emotional state. So one of the things that I'm always concerned about is that we may jump to a psychological response when there might actually be a neurological component there. And what I mean by neurological, I don't necessarily mean that there's a damage to the child's brain, but there are certain types of neurological disorders, processing disorders, learning disorders, autism, attentional disorders, different things that are about how the brain is wiring and communicating with each other. And sometimes, there are, as with any type of developmental disorder, there are ranges of them. You can have a mild version, a moderate version, and a severe version. And of course, if it's severe, from the jump, you might see certain symptomology, and someone says, "Oh, your child is diagnosed with X, Y, or Z." However, often children have processing disorders. There's something called sensory processing disorder. I'm an occupational therapist. That affects, conservatively, 1 in 25 people. Yet it's one of the most unknown, unrecognized diagnoses. And the reason why I'm bringing it up is when it's not spoken of, often children can be having these kinds of challenges. And then as they're compensating through life, right? Because it's a matter of strengths and weaknesses. And so I have these weaknesses in my brain, but maybe I have a relative amount of strength that can help me compensate for it. But then there are external stresses that come along. And, we don't even have to speak to the external stresses. We're all living through it. But as you add external stresses to an already strained or fractured brain, then you might find that your child who was doing well before in school and who could hold it together, who had better ability to have better attention and better regulation of themselves, have lost that ability. And now you might say, oh, well, it looks behavioral because it just developed. And you may think that it's because of an external or environmental impact. But the truth of it is that they may have been living with this internal processing problem. So what I want to contribute to the conversation is we shouldn't always sit with investigating it along the lines of psychology, while I respect that completely, right? I am a psychologist as well. But part of what I want to say is let's look at the neurology. Do we have an intact brain? Because brain and mind interrelate with each other. And if I have a brain that's faulty, it's certainly going to impact my mind. You know, not to scare anyone here, but it just to offer this piece of information. You know, someone put into the chat about the Parkland shooting. And when, you know, I live very close to that area, but when that shooting happened, I went back and I looked through time. I looked through the profile of the shooter, and then I looked at all of the, you know, mass shootings, mainly committed by boys and young men. Wow. And when I looked back at that, most, or if not all of them, had a history of processing disorder. And so, you know, you hear this argument of we have to deal with mental health issues, and absolutely we do. But we also have to look at brain function, because brain function impacts mental and psychological function. So I just wanted to throw that component in there, because we have a tendency to lean towards a behavioral, psychological, mental health approach. Absolutely necessary. We need so much more of that. But not necessarily should it always be the first place we look. I'd like to encourage us to look at, do we have an intact brain to support an intact mind?
Yeah.
Just to add to Dr. Julia's perspective, which I respect tremendously, just coming from a hospital pediatric health environment, this is one of the things I always try to encourage parents. And I know there's a cultural component that sometimes is a barrier, but early assessment and early intervention. There's here in Florida, I can only attest to Florida and Puerto Rico, we have things called like early steps and PPEC and different centers that you can actually go with a referral for a pediatrician, and they will evaluate your child's milestones, make sure that they're right on target, make sure that we're not missing those processes, like for example, those sensory processing disorders that then end up in being clinical anxiety. But when you go back into the history of this child has tantrums since being born, or too loud noises, and people automatically go to very severe or more well-known diagnoses like autism or ADHD, but in reality it could be a brain processing, sensory processing difficulties. And so I love, and this is what I tell my parents, I would love for you to know more about how your child learns and interprets the world and environment around them, so we can have healthy expectations of their behavior and their responses to certain situations. We cannot ask, for example, if your child has early intervention and early assessment, we find out there's a cognitive issue, like a verbal comprehension issue. This is a child that you might explain something and might need repetition over and over again, and the parents or the caregivers get frustrated. Is this normal? So it's just about normalizing and defining clear expectation for your individualized child, because each child is a world of their own. And so it's really important to have healthy expectations, so we can also provide them with healthy consequences and healthy routine and healthy, you know, daily, just mundane things. And it looks different in every child. So I think that's very important to know as well. So thank you for that.
I'd like to ask a question. We have many people in the Zoom and who registered questions about from children's museums. So what role can children's museums help in combating this crisis? How can they position themselves as a resource to the community in this moment that we are in? I'll go Dr. Marva and then Dr. Marina.
So right after Katrina happened here in New Orleans, our Children's Museum, I may have shared this story with you before, Brianna, but immediately after, our Children's Museum, you know, the whole city was devastated. The whole area was devastated. In one particular area, there was one school that was standing, and it had to become the high school, the elementary school. And in Florida, I know you all have been through less hurricanes, but our local Children's Museum put up a tent and they created a tent program so that children would have the opportunity to play. They would have the opportunity to play, they go to school, and my role was simply to do the evaluation for that particular program. But it was wonderful. It was astounding to see children in the midst of this global crisis where everyone was traumatized with after Katrina. But when they went into that tent, you could see their little eyes light up, and that they began to focus on play, which is what they needed. So it was an unusual approach, putting up a tent in the middle of the parking lot, but it became part of that child's ability to see that things are okay and I can play.
And and that natural need, the natural desire to play.
Yes. Yes.
Yeah. Dr. Marina, do you want to add on?
This is just a very passionate topic of mine because I feel like places like children's museums are safe spaces where you guys are in a unique position to create programs for prevention. Culturally, and I'm going to talk about the US, culturally, we like to address issues when they're already existing or when it's a crisis. I think children's museums can be part of our primary prevention program, which I am very passionate about, where you can have and host little classes of mindfulness and like 3-year-olds to 6-year-olds, or creative play, like Dr. Marva was saying, which is so important, that creative play and that imaginary play, places where children can feel like children and really have that unique developmental experience. So for me, you guys also have certain fundings and not almost like the barriers that we have, like insurance issues and wait lists. You can host all these events, and I know sometimes you can charge, but sometimes it could be free. And you guys are institution, like people look at you like an institution, like let's go to children's museum on a Saturday. And I know people go as families and spend time as family. So as museums, you can also have and collect resources from your local, your local environment. Like if someone comes to you and says, do you have like a list for referrals for psychology, for social work, for parenting groups, and you having a updated referral list, something as simple as that, I think will be so beneficial in the work of prevention. And I don't know, it's very unique. Museums have always have such for me, a safe space mentality. Like Dr. Marva was saying, children can go play, families can go and be families and not be hindered by the world around them. So prevention, primary, and hosting different events, such as this one, by the way, this is an amazing opportunity. So I think that's something that you guys can continue to produce and do for your communities.
Being in another hurricane destination, I know years ago down in Homestead, after one of the hurricanes, I think maybe Katrina, there was basically a tent city set up in Homestead, and we would go down to where the people were living in tents and provide that play with them. But I do like the idea of this concept of prevention, right? And then you're also positioning yourself within the museum and the community as a place that's already providing. So when the crisis hits, you can become another go-to resource because you've already established yourself, in that realm. Dr. Kat, you were had your hand up.
Yeah, I was just going to echo everything that Dr. Marina and Dr. Marva said and add that that is really, when we look at the research literature in terms of access of mental health services, if we want to bridge that gap, because it is tremendous of like what is, currently being done in clinics versus what we know where the science is, we really need to think about bringing services to where children live, learn, and play. And I'll add worship, because I think faith also is a place that a lot of people go to get support. And if we can work together as this village that we've referenced so many times, as a community, as people supporting each other, there's going to be so much more power to that. And when people feel connected, when they feel like they belong, that only prevents us from some of the very long-term adverse impacts of mental health, and we promote positive mental health in our community. So I honestly cannot thank you enough for offering this conversation to the community, and I'm so excited that you all have positioned yourself as a museum in this work.
Mhm.
Something that came up in the chat is, you know, an effect of the post, while we're still in COVID and the pandemic, the social anxiety, right? So, you know, it's how do you welcome these families into your organization and say we're open and we're safe, but there's still this extreme social anxiety around people of, you know, feeling safe, health-wise. And so it's trying to find that balance for people, inviting them back through the doors. I don't know if there's anything else to comment on that, but it's a tricky balance. Dr. Mata, I saw you took a deep breath.
Yeah,
I don't know if you
no, I just wanted, I was just thinking about routines, and I wanted to talk a little bit about that. But I'm constantly amazed at what children can do and what parents can do creatively, and finding out from them, as you spoke earlier, Dr. Harper, to say we don't necessarily need to pathologize it, mentalize it, or, you know, I'm going to say neuralize it, but there may be any number of other ways. And I want to put a plug in these last few minutes for cultural practices approach to mental health. This is the work that I've been doing now, and seeing the response in parents when they're in crisis. And I'll use this example. I went over to Israel. This is back in 2009, after the war in Ethiopia, and the Israel had gone and airlifted the folks to bring them to Israel. When I did my talk about the hair combing, that's the research that I do, attachment and bonding while combing hair. And one of the persons there, one of the students there, she went to her community and they combed hair together. They were all becoming disconnected because of they were in a new place, it was totally stress, but they didn't have each other. And coming back together with a cultural practice, whether you started out, Brianna, giving homage to the Native Americans in the land that we're on, but there are different practices within groups, cultural practices. Those are their strengths that have led to their survival, resilience, and joy over generations. And this is what we can get back to. Whether or not it's a family dinner meal, there's a whole line of research on the family routine and dinner. And
I prescribe that to my family.
Yes.
I am prescribing you Sunday meals together as a family for 20 minutes. Yeah.
Yes.
fill out the RX.
Oh yes, completely. I take it seriously.
Yeah. And mine is talk, touch, and listen while combing hair, 10 minutes a day for 365 days. And you have an opportunity to prevent as well as listen and heal. I'm going to be quiet.
No, I want to honor, there's a specific question in the chat from Olson. So I'll put it to anybody of our panelists. If my child has heightened anxiety at school, over homework, workload, a very common common theme, right? How do I balance discipline with addressing her emotional needs and stress?
I
Dr.
think,
Marina?
it's a loaded question, and we can talk about that for an hour within itself. But I think, having the role as a caregiver is really important to be defined within the family system and the role of the child. So creating those healthy expectations, and it depends, of course, we were talking about if your child has different processes or different diagnoses, but we know that school stress is very significant, and nowadays they just jump back and people assumed that kiddos, that's what they wanted, that's what they needed. And what we've seen, I can speak for myself, is an increase of anxiety because it's too much. So I think this is a perfect opportunity while, for example, you braid hair or you have family dinners to promote and teach your child how to problem solve. Because remember, your executive functioning, which is that part of your brain that tells you like, okay, this is what I need to plan. And young children, especially, which is our audience today, they don't have that. So it can be as simple as helping them problem solve. Let's see the calendar. Let's see what we can plug in assignments. When to ask teachers for a Plan 504 in Florida, whereas for special accommodation. So instead of having 60 problems in a math homework, you have 20. So there's different things that you can ask your pediatrician, your neurologist for accommodations at school. But I think the base of it is having those conversations about how to problem solve. And that may look different in different cultures and different families. But we need to teach our kiddos how to problem solve, because when they're young in school, but then it's going to be high school, there's going to be college, there's going to be work. So if we can have that foundation of, I know how to identify a problem, I know how to creatively look for solutions and ask for help when needed, I can put them into practice and see what works and not works, and then pick something that works for us, then they can carry that through their development, and it can be very useful.
It's making the time for that problem
Yes.
solving, right?
Mhm.
Yeah. Dr. Kat.
And I'll add to this great recommendation is really also acknowledging the emotional needs and stress. I think oftentimes as parents, we think about like, our kids are not paying the mortgage, but that's not on our kids. Like, that's there. We can't, we really can't belittle their problems or their emotional stress. And they really are feeling it, and it's been such a major transition. And so even just acknowledging them and their feelings, and saying and offering then, if you're working with them through problem solving, but modeling that for yourself, like even, if your child's feeling frustrated, say like, I hear you, it's been frustrating, and not make it so much about you, it kind of hone in on what they're telling you and believe that what they're saying to you is true.
Validation.
Yes, lots of validation. And then offering then to try to solve it together. Let's work on it together.
I have one, I'd hate to narrow this, we have to stop, but my final question, I'm just thinking which one it will be. And if we can talk about it from, either a educator's perspective or advice for educators, because I know we have a bunch of educators in the group tonight as well. Talking about big things with your kids, Ukraine, grief. How do you, in a school environment, how do you address these with the students? And often in a school environment, more questions come up than in the home environment. Like, how do you address them? And especially, you can't talk about them from any political angle, but should they be spoken about? And how should these big issues be spoken about? Dr. Marva.
I'm going to put a plug in for Sesame Street. Because Sesame Street has a number of different tools and videos to talk about tough topics, whether or not it's racism, whether or not it's bullying, war. Sesame Street has a video. So that's my suggestion for teachers to use those videos in the classroom to begin the conversation. Tie it to whatever the particular lesson plan is. We're learning ABCs. This is for older children, but the children, that I'm thinking too in 0 to 3 age group, Sesame Street with the images, the visual images, and children, author series. Anyway, I'm going to be quiet.
No, but it's amazing because it's true. There are things out there that are free, like Disney movies, like Inside Out, that talk about emotions, the new Panda movie that talks about like mother-daughter relationships. So those are moments that you can watch and have those moments with your children while discussing tough situations. But coming from an educator's perspective, I always encourage them to communicate with the parents first, because we never want to make a parent or a child indirectly or unintentionally feel bad about their cultural beliefs or their parents' political views. We know right now we're living in a time, always lived in a time, where politics, race, ethnicity, those are some huge topics. And sometimes teachers tend to hold back because there is backlash, and the backlash is real. So what I always recommend is going to the parent first. I am, your child, made this comment, and I told them that that was a very valid question that they had, that you are also, for example, they say, Teacher Mary, I'm worried about the war in Ukraine. You can validate their feelings and normalizing their emotion while saying, you know what, when mommy comes today, or daddy, or whoever comes to pick you up today, I will let them know that you're worried, and we can work together to see how we can address it. Because some parents or caregivers might not want that education coming from the teachers. But don't hold back on prevention. Teach them mindfulness from a very young age. There are free courses, YouTube little channels that have little 5-minute meditations for 0 to 3 years old, and encourage them to have a safe space. So when they go to you, you are able to go to the parent or the caregiver. That is my personal recommendation.
All right, well, we are at time. We're 1 minute over. So I just wanted to thank the 4 of you for joining us tonight. I do also want to thank everybody who was listening, asking questions, and active in the chat. We appreciate that you are here with us, and value this topic to show up on 8 o'clock our time on a Wednesday night. And very special thank you to our panelists. I'll go through you all once again: Dr. Kat, Dr. Marina, Dr. Marva, and Dr. Julia. Thank you so much for joining us. I do want to say these quarterly conversations are happening quarterly. So I do want to let everybody know about our next conversation, if I push the right button, happening. So save the date. Our next quarterly conversation is on June 22nd, and it is called Kids and Pride, How to Be an Ally. And we'll have information about that coming out on our social media, website, eBlast, and all of that, so that you can register and be a part of that. And as we form our panel for that quarterly conversation, we'll also put the names and faces out as well, so you can see who you will be engaging with. And so without further ado, thank you once again, everybody, for being there. And I hope this was insightful. I know I've learned a lot, and now going to take on a few of those tips as a museum person and as a parent as well, and an educator. So thank you once again to our panelists. And we hope that everybody does have a lovely, wonderful rest of their Wednesday and rest of their week.